my name is Erica French, and I'm in the class Innovations and Technology in Occupational Therapy with Dr. Reynoso. I'm at Nova Southeastern University in the Doctorate of Occupational Therapy program in Tampa, Florida. So today I'm going to be talking to you about assistive technology. And specifically, I'm going to focus on one of the principles of assistive technology, and that's going to be the second principle. I kind of relate it back a little bit to the first principle, which is person centered, because with the second principle of being functional outcome and participation, that really goes back to being client centered. So, your functional outcome and participation is really focusing on how is the client using this device? How is it helping them? How is it, reflecting them as a person? And rather than just choosing certain technology and it not reflecting them as a person, because once you stem away from it not being client centered, they're going to lose their motivation, they're going to lose their confidence level. All of these different things tie into it. So, the best way that I understood assistive technologies, specifically the second principle, was to put a scenario in my head. So, let's say that we have a 20-year-old female student who needs a communicative device, some sort of technology device that's going to help her communicate. But the tone of voice is wrong, the speed of the voice is wrong, and it's not reflecting her as a person, as the person that she is and her personality. All of a sudden her motivation is low, her confidence is low. That's her only form of communication. It has to be client centered. If it doesn't reflect her as a person, she's not going to want to use it. And if that's her only form of communication, then that's going to be that's going to be a problem. So, putting myself in my client's shoes, I want to go out there, I want to mingle, I want to talk with my peers, and I want it to be a conversation between me and that other person, not the other person and my communicative device. So, really making sure that assistive technology is client centered. Going along with it being client centered, it really reflects on the PEOP model. The first part is person, making it client centered, making sure that this technology or device is really going to complement and reflect my client as a person, as their personality, as who they are, truly who they are. And the second component is environment, making sure that this technology or device is appropriate for the environment that they're going to be in. And that ties in with the next step, occupation. Occupation and environment, I see, kind of goes hand in hand with one another. Every person has daily occupations in their daily living, and really going back to the person part of it, focusing on, okay, my client, what does she do? What does he do in their day-to-day basis? What is their occupations? What are they? And really focusing in on that to make sure that their technology, their assistive technology, is going to be appropriate and going to complement them. The last portion of that is performance. So, going along with all of the other three, as long as you're client centered, it's appropriate for the environment, and it's reflecting their occupations, then they're going to want to perform and their motivation is going to be high, their confidence is going to be high. But as soon as you take away from that and you focus only on the technology and you're only looking at, okay, well, I think that this is going to work best for you, but maybe that's not part of your occupation, then it's completely irrelevant to the client. So you really want to make sure that it's very, very client centered. And that also goes along with the OT framework, looking at the client factors and their performance, specifically their motivation. You want them to be fully engaged with this assistive technology, and in order to do so, it has to be client centered. So that's my understanding of this second principle, and I look forward to seeing you in class and learning more about AT. Thank you.